Good afternoon, Dimitri. I'm Dr. Catherine Zollman. I'm Medical Director at Penny Brohn UK. I'm also an NHS GP who's been working, supporting people with cancer in integrative and holistic ways for the last 20 years. So it's a real pleasure to be here with you. Can you tell us a little bit about who you are and who Big Health are?
Absolutely. So lovely to meet you. I'm Dr. Dr Gavriloff. I'm a sleep medicine specialist and clinical psychologist by training. And I work for Big Health. So Big Health is the company behind Sleepio and Daylight, whose mission is to move towards helping millions back to big mental health. So it's a digital healthcare company. And I also work for the University of Oxford and for Oxford University Hospital's NHS Foundation Trust, where I run a sleep service.
Great. And Big Health have very generously offered Penny Brohn clients free access to the two apps that you mentioned, Daylight and Sleepio, for the duration of the COVID lockdown and 12-month free subscription finishing at the end of 2020. So can you tell us a little bit about these apps and what they do?
Sure. So we've got Sleepio, which is a 6-session online sleep improvement program. And it's based on something called cognitive behavioral therapy for insomnia, CBT, as we know it. And this is the first line recommended treatment in national and international clinical guidelines for insomnia. And we have Daylight, which is more of an app, and it's an app that's designed to help people with persistent and more sort of generalized worry and anxiety. It's also based on CBT techniques, but the idea is it's something that helps the individual develop a familiarity with these techniques such that they can kind of use them as and when they wish.
Brilliant. Well, both of those things, sleep disturbance and worry and anxiety, are incredibly common in the cancer community. So can you tell us a bit about the sorts of people that are already benefiting from these apps?
Yeah, so both Sleepio and Daylight are what we call evidence-based approaches, which is to say that they're approaches based on a solid psychological theory that's then been really well tested as a program, as an app in clinical trials that we've run ourselves. And the results from these trials show that, there are good improvements, statistically significant improvements to both sleep and to anxiety in the people that have taken part in these trials. But in terms of kind of real world use, one of the great things that we've been doing recently is rolling out Sleepio and now Daylight to larger portions of the UK. And there have been 2 big rollouts in the Thames Valley and in London particularly, which have been very exciting. And we've now had, I think, as many as 100,000 users in the UK through Sleepio. And so it's really getting out there to people. But alongside that, we're also now offering Sleepio and Daylight to NHS clinicians too for free. So that's another great thing to be able to do.
Fantastic. And are there any cautions or contraindications, any situations in which it may not be such a good idea to use these apps?
Yeah, so by and large, no, these are applications that are there for sort of general use by people, but there are a couple of caveats and certainly things to be aware of, particularly regarding Sleepio. So Sleepio is sort of a group of different techniques. We call it a therapeutic approach. So there's various techniques that are sort of therapies. And then alongside that, we also have expert articles in a community forum. And so there's more to Sleepio than just the CBT. But within the CBT, there is a technique called sleep restriction therapy. So sleep restriction therapy may or may not be appropriate for certain groups of people, particularly people, for instance, with excessive daytime sleepiness, EDS as it's called clinically, or people with high fatigue, for example, maybe cancer-related fatigue. So that particular element of the treatment is worth just being sensible about and talking to your doctor about. And I guess the bottom line of all these approaches is that it's always worth talking to your doctor before you start doing this if you have a significant health condition that you're managing alongside this, just to make sure that they're aware and they can give you the best guidance.
Absolutely, and lots of them actively recommend CBTI, which this is based on, for their cancer patients, don't they? Exactly. And I suppose, just to be clear, sleep restriction, I guess that means reducing the number of hours that you're aiming to be asleep. Is that what?
Sleep restrictions rather unhelpfully named, but it's really a time in bed restriction. If we think about it slightly more comprehensively. What we're trying to do is we're trying to help people who have, through no fault of their own, sort of develop broken sleep. Very often we see that in people who have insomnia, alongside whatever else they're trying to manage. And that broken sleep may be across quite a long period of time. So they may be in bed for a long period of time and actually getting relatively little sleep. And so we describe that in terms of something called a sleep efficiency. So your sleep efficiency is the proportion of time spent in bed asleep. And actually, if you're spending a lot of time in bed but not very much time asleep, your sleep efficiency is relatively poor. And if you have, most of the time you spend in bed asleep, then your sleep efficiency is relatively good. So it's a good proxy for telling us how well you're sleeping. If you're someone who, does have quite a long time in bed, actually reducing that so that we can kind of concertina sleep, if you like, into a big block is what sleep restriction is really all about. And it's a little bit more complicated than that, but one of the things it does result in is increased daytime sleepiness, as you might expect, because you're just reducing the amount of time someone's in bed for. Of course, you then expand it out gradually over the course of the treatment window, such that people are getting back to sleeping for a big block and for longer, and to work, to the extent to which they need it to take place. But it can be a very difficult thing for people to go through if they do have things like fatigue and other things as well. The other groups of people that we might want to be very careful about is with our pregnant women, for example, or people who work shifts, who have shift work. And so all of this is covered in the guidance that we have on Sleepio, so that it makes kind of sense to the person who's undergoing the treatment.
Great. And one of the things that we encourage people to do very much when they're trying any kind of integrative or supportive therapy is really to listen to their bodies and listen to their response. And if they're not happy with the results of it, then I guess, as you say, seek medical help or seek professional support with that rather than trying to persevere on their own.
We completely echo that. It's listening to your own body, listening to what you feel is helpful for you, and also then listening to your doctor or nurse or your healthcare provider as well, and keeping them in the loop, I think, is really important too. Yeah. Because actually they need to know what's going on across the board, not just in relation to the problem that they're managing or helping with.
Absolutely. And speaking as a health provider, it's really useful to get that feedback, because that helps educate the professionals as well, because some of these techniques are not necessarily things that we've been trained in ourselves. So it's really helpful to get that ongoing feedback from our patients. So Dimitri, you work, obviously when you're working in your sleep clinic, you're seeing people one-to-one. Can you tell us about situations where it might be better to see a professional one-to-one than to use an app?
So what's interesting is that I think probably societally we often think about sleep problems as being fairly unidimensional. There's one type of sleep problem, but actually sleep disorders are really, really varied, and there are lots of different problems people can have with their sleep. There might be things like insomnia, where people struggle to fall asleep and stay asleep despite an adequate opportunity to do so. There might be things like sleep-related breathing problems, where people have some sort of respiratory obstruction or something that requires a respiratory physician's involvement. But there are also other things that might be neurological or might have links to mental health problems too. And so although insomnia is the most commonly occurring sleep disorder by far, and it's the one for which CBT for insomnia is clearly best placed to help, there may be people who could benefit from things that you might find in Sleepio, such as the stimulus control advice or the other more general advice or the cognitive therapy that might help with their sleep disorder. But actually, if it's an underlying sleep disorder that isn't insomnia, then I think going to your GP and seeking out the right specialist to see is really important, because clearly you need the help for your particular problem.
But giving it a go for 6 weeks and seeing how much it improves wouldn't be a bad thing, wouldn't be a bad place to start.
It's not a bad place to start, I suppose, but I think that one of the things that's important is to understand what if you've been to your GP before and you've said, listen, I'm really struggling with this. This is now having an impact on my day-to-day function. My mood's, impaired, or struggling with my mood, struggling with my relationships. It's a good enough reason to go and see a GP. Then have that conversation about the symptoms. It's that I wake up in the morning, I have a headache or whatever it might be, and actually that's where the diagnosis is made. If it's sort of the racing mind and struggling to fall asleep at night because it's just on edge and that kind of thing, that's where I think Sleepio is a really good shout. But it's worth, if you have any kind of confusion about whether this is the best thing for you, you can certainly give it a go, but always go back to your doctor if you're not getting the help that you need, because they can provide it.
Fantastic. So now let's get a little bit more into the practical side of things. How does it actually work? So imagine that I'm somebody who's been diagnosed with cancer, never had a problem before I was diagnosed, but through the uncertainty of the diagnosis and waiting for results, I started to sleep a bit more poorly. Maybe I then started to have some chemotherapy, put on some steroids, which further disrupted my sleep patterns. And now I'm finished the treatment, I'm still having a real problem kind of getting back into my prior sleep patterns, or something which I think is healthy for me. How would I start, and what would be involved for me?
Well, so that sounds like a really reasonable problem to be having in terms of falling back to sleep. If you've been through a journey like that, it's clearly a very difficult journey, then struggling with your sleep is entirely normal. I think one of the things that's very interesting when we think about insomnia is to think about it in terms of how it starts and what keeps it going. So we tend to think of it in terms of people who are predisposed to insomnia, predisposed to a sleep problem, and then there's something that kicks it off, something that gets the sleep problem going, and that's kind of what you've articulated there in the journey and the anxiety around the diagnosis and all the medication people are taking and having to manage life, etc. It's all entirely understandable, but pretty stress-inducing. And then there's some sort of normative change in sleep. So sleep kind of takes a hit, if you like. What then tends to happen is, for some people, sleep then the ship kind of rights itself, and people get on with it, or sleep kind of falls back into place. And for some, that doesn't happen. And for some, it maybe gets a lot worse, or perhaps it just becomes really, really prolonged. And often for these people, it's because of the way in which their situation is set up. Perhaps it's their treatment might be having something to do with their sleep, but it's also probably to do with two other things. And that comes back to the C and the B of CBT, the cognitions, the thinking, the emotion around it, and the behaviors. So very often when people develop a sleep problem, they're thinking about the sleep problem, and their feelings towards sleep problem become different. Their feelings to sleep become different. Often it's I want sleep and I need sleep, and of course you do, but the desire to get it and the desperation to get it, again, completely understandable, but often pushes sleep that little bit further away. Viktor Frankl, fantastic psychiatrist, said that sleep is like a dove that comes and sits by you until you look at it or try and touch it, and it sort of flies away. And that sort of rather poetic understanding of sleep effort it is kind of part of that. There's something else there about the behaviors, and I think that very often people try very hard to manage their sleep problem through being pragmatic, maybe getting to bed early or resting more, or perhaps just opting out of some of the social things that they might have done before. And actually, whilst that is often very sensible in the moment and thinking through it in terms of trying to manage the sleep problem, what it can often lead to is perpetuation of the sleep problem. It can kind of keep things going, keep things stuck. And so the C and the B of CBT address the thinking problems, the stuff that people don't want to be thinking but get caught up in, and the B, the things that they've kind of got into a habit of doing. And the way we tend to think about it is they've kind of got out of the habit of good sleep. Yeah. And so there's that, and then of course there's the other stuff too. There's the stuff that's related to their care for their cancer, which also needs to be managed sensibly. So, for example, steroids. You follow the advice of your medical team, who may advise you to take it in the morning or whenever. So this is when it comes to the cancer care, following the advice of your medical professionals is really important. But when it comes to the kind of the understandable sleep problems, then coming back to CBT is also really, really useful.
Yeah, and I think there's so much around in the press at the moment about how important good sleep is for your health, that when it starts to evade you, then you get stressed about not sleeping, exactly as you say, and then that creates another layer of worry that stops you sleeping. So no, that's really helpful. So can Sleepio only really be beneficially used when people have a period of relative calm in their lives? Or is it the sort of thing that can be used in the middle of a very stressful situation where perhaps things are changing an awful lot?
That's a really good question. I think this is something that's going to vary for different people. I think that in a kind of a general sense, it might be best to wait until things are relatively calm before embarking on the CBT bit, not least because CBT requires quite a lot of effort. Often this is stuff that can be quite challenging to do, particularly sleep restriction and stimulus control. So having a relative block of calm is probably quite helpful for that. But also, I think I'll just come back to the point that Sleepio as a program includes lots of other bits and pieces. And so alongside the CBT program, there's also expert articles and information that people get on their sleep. And that might be quite helpful, sort of that they can kind of fit in around it. But there's also things like a kind of community forum that people can access to ask questions. And so Sleepio is lots of different layers really, but the CBT component I think is it probably be most beneficial to people if they can kind of really devote some time to it, and maybe that's best done when there is a period of relative calm.
And how much time on average do people need to commit to it? How much time and how much energy, I suppose? Because by definition, we're talking about people who have got sleep problems, which might end up them being quite exhausted and fatigued. But you're also saying it takes quite a bit of commitment and quite a bit of energy. So how does that square up?
Yeah, so this is another good question. And again, it's going to depend on the individual. I think one of the key things to just bear in mind is that if you've got a sleep problem, you will know that it's worth sorting out. Right? This is not something you want to kind of put off, and it's not something that people often feel like they're getting much help from elsewhere. So making sense yourself of how much you're willing to do here, how much effort you're willing to do here, I think is a useful starting point, and Sleepio does set you up for that quite nicely. But one of the things that's very important is to understand that people can do this at their own pace. Sleepio is relatively personalized, so it takes information you give it on your sleep patterns, and it takes information on other elements of who you are and what you're going through, and sort of tailors the program to you and to your needs. And so my feeling is that whilst the program can be quite flexible, it's also important to just be very sensible about how you're going to make it work, and how you're going to have a go to kind of maximize your chance of making it success.
And is it the sort of thing that people can use if they're in a family setting, with a partner who's trying to sleep in the same room, or with small children?
Absolutely. I think that one has to be careful, if you've got a very busy house and you've got a bed partner who snores very loudly or who wakes you up, then CBT may not be particularly helpful for that kind of a problem, because it's not necessarily designed for that. But I think that none of us live in a kind of a perfect situation. All of us have lives with children and family around, or if not, with other things around that can kind of get in the way. Making sense of that's important, and thinking about how best to devote time to do it. We typically say that each session is about 20 minutes a week. So if you're doing a session a week, so a bit like doing therapy, CBT, you'd have sort of a therapy session each week. We'd recommend that people block that period out, each week in a diary, and perhaps sit down. Sleepio is best done on the computer. So sitting down, making a kind of a plan to sit there for 20 minutes and really go through the program. Don't feel like you have to rush it, and really sort of engage with it as much as you can, I think is going to be the most helpful way of approaching it. When it comes to implementing the things that the program might suggest, being clear that with your bed partner, if you have one, or with your children, that this is what you're doing as part of your efforts to improve your sleep, I think is really important. Helping people often want to be supportive. They don't want to be problematic, and so if you explain to them what you're doing, perhaps they'll be more helpful and more likely to give you the space you need, perhaps.
Great, good point. And finally, if people have gone to their GP with a sleep problem before and been prescribed some sleep medication, which they're now taking to help them with the problem, is that compatible with starting to use Sleepio as well?
Yes, you can continue to take your sleeping medication alongside Sleepio. The two are compatible. And if you did decide eventually that your sleep was improved as a result of the program and you wanted to discontinue your medication, we'd recommend you do that with your doctor's advice, and do it in a safe way. So don't make any changes to your medication unless you talk to your doctor. But the two are not they're not incompatible.
So imagining that I'm about to start using Sleepio, practically, what do I need? What sort of kit do I need? How much time do I need to set aside? Just talk us through the practicalities.
So we recommend Sleepio is done on a computer. It is available as an app too, but we recommend doing it on a computer because it improves the experience, I think, for the individual. But it is something that we typically you do in 20-minute blocks across 6 weeks. So you have a weekly block of 20 minutes, which is your kind of therapy session, if you like, and it's sort of analogous to therapy in that sense. So what do you need to do it? Well, you need a bit of gumption, I guess, to do it. So the motivation to sit down and actually take some time to go through the program and really engage with it. And one of the best things to do there is to, as I say, to kind of give this, maybe if there are other people in the house, let them know that you're doing something that you don't want to be disturbed while you're doing it, and make a plan as part of the recommendations for the individual sessions. You may have a plan that you will then kind of put into practice throughout the week, and so giving yourself a bit of time after the session too might be helpful too. But it's something that most people can get on with. It also requires conversational English, and so these are the kinds of things that people.
And do you then feed your progress in so that next week it's modified for you? How does that work?
Exactly. So you keep a sleep diary, which is the sort of the standard for sleep medicine, sleep problems, and that's all done through the app, through the program. So you input your sleep each night, your sleep diary scores each morning, and the program will then titrate or change your sleep window according to what you input.
Fantastic. Is there anything else that you think people need to know about Sleepio before they give it a go?
We have a range of different articles that people can read without actually doing the program. So if there's stuff that people want to know about in terms of sleep wake regulation, how it works, the sleep science, thinking about other sleep disorders, things like that, that's all available through what we call the light sleep guides. And so there are a range of things there that pertain to being a new parent, to shift workers, to exercise, using wearable technology to clock your sleep, that kind of stuff too. So,
and are those available on the Big Health website, or?
They're available through the Sleepio website, and I can give you the link to that.
Thank you so much for taking the time to talk to us, Dimitri, and explain some of these the wonderful apps that are now available to people affected by cancer and using Penny Brohn services. So thanks once again to you and to the whole team at Big Health for this wonderful offer, and we hope that many people will be able to benefit from this.
It's a real pleasure, and we wish them all very well.